Ted, we have the results of your biopsy. Unfortunately, it's come back positive for prostate cancer. This must be a shock for you. What I'd like to do though is go through the information we have to hand about your situation at the present time. And once we've been through your test results, then we can discuss the various treatment options that are available to you. Is that okay?
Oh yeah, tell me everything you can, you know. So, like how bad is it?
Well, Ted, prostate cancer is a serious disease, but in your case, we've detected it quite early. And at this relatively early stage, it's favourable for successful treatment. Now, there's a number of treatment options that we can offer you, including surgery, including radiotherapy. But before we discuss treatment options, I'd like you to have a couple more tests, including particularly a screening CT and a bone scan. That way, when we see the results of all the tests, we can make a more informed decision about the treatments that we should consider. Now, from the information that we have to hand, we can see that your cancer is staged at what we call T2B, with a Gleason score of 7, which means that it's at an intermediate stage. It means that while the cancer might be confined at this stage, there is some risk that the cancer could have spread microscopically, and so it could recur even after treatment.
I just feel like the wind's been knocked out of me, you know. You think deep down, you know, there's a chance you might have the cancer, but of course you think it's never going to happen to you.
Yes, this must be hard for you. On the positive side, the disease in your case is presenting quite early. And prostate cancer is a disease that can be treated and successfully managed. Hi Ted, hi June. Well, we have all the results back from your tests, and the good news is that the cancer has not spread. So now comes the hard part of making a decision on what to do in your particular case. So what I'd like to do is discuss with you the options available for the various treatments and weigh up with your own personal circumstances what would be best. I'm going to give you some material to take away because there's quite a bit of information to take in. I'm going to ask you to spend some time with our urology nurse who will also walk you through the detail. Have you got any questions straight away?
I guess the big question is, what are my chances of making it through all this?
Well, as a ballpark figure, around 85% of men with your type of cancer having the treatment of radiation or surgery, 85% are alive at 5 years.
Okay, well, what treatment do I have and what does it involve?
Okay, now the options I'm going to discuss with you were arrived at by a multidisciplinary team approach. And we've taken on board the results of the DRE, PSA and the TRUST biopsy. Now, but these options will still need to be weighed up with your own personal circumstances and preferences.
I just hate the thought of this thing growing inside me. I need to do something about it. I just feel like the surgery is the way to go for me, you know, get it out. I'm not sure about the radiation therapy. If I did have the operation, how long would I be off work? Because I can't afford to be off for too long. We haven't got a lot of money.
Well, Ted, it's a personal thing. It just depends on your level of fitness, your state of health, what sort of work you do.
I'm a high school teacher. I teach geography and history.
Well, in that case, I'd expect to see you back at work within 2 or 3 months. Some men with external beam radiation therapy, some men work right throughout that treatment.
Well, what do you think I should do?
Well, at this point in time, Ted, there's no clear-cut evidence for the superiority of any treatment over another. So what I think we should do is discuss what's best for you in your own personal circumstances and preferences, and looking at the potential and the actual side effects, so we can make a decision together.
Well, I just want all the information I can get. I mean, we've got those brochures and the booklets, and I just want to know everything I can possibly know about it.
There must be heaps of information on the net, Doctor. Can you recommend some sites for us?
Certainly. There's a lot of information available on the net. I would caution you, however, not to be overwhelmed. But I would suggest two sites. I'd suggest the Cancer Council and the Prostate Cancer Foundation.